Then sir was the SRF fellow in DBT project for PhD during his PhD, and uh, at GB Pant University of Agriculture and Technology. Then sir has also qualified the ICMR for 2000, in year 2005. Sir is a recipient of CSI Net, as well as he is a recipient of ASRP Net examinations. And sir, previously, before joining the veterinary college Hassan, sir worked as a assistant professor at Department of Veterinary Public Health in KNP Veterinary College Shirwal, as well as sir was working here in the Bombay Veterinary College also, Mumbai. And sir is the PI of around 5 project, and he is working as a co-PI in one of the project. And sir has a very vast experience of the NADL accreditation as a quality manager, and he has handled National Pesticide Monitoring Project and iShare Outreach Program and other applied projects. Sir has published around more than 76 research articles in scientific journals, and he has authored a book also, DNA-based identification of animal species. And for his doctoral research, sir has been awarded the Young Scientist by the Indian Society of Veterinary Immunology and Biotechnology, and he is a recipient of the prestigious Professor Mahendrapal Jonosis Award, and he is also recipient of several awards in conferences and symposiums. And sir has worked and is working as a reviewer in the several editorial reviewer as editorial services for the several peer-reviewed journals of national and international repute. And sir has some of the foreign experiences also. He has attended 56th International Congress of Meat Science and Technology, which happened in Belgium 2011, and which was supported by the DST. And sir has served as a member secretary of the Institutional Biosafety Committee of his college, and he is a member of Executive Council of Indian Association of Veterinary Public Health Specialist. So sir has a very vast experience in the veterinary public health, and we have the very right person today to talk on the role of veterinary services in zoonotic disease preparedness. So I request sir to start his presentation, and we all are eager to hear him. So, Nagappa sir, please.
Jump into the topic assigned. 1 hour or so, we'll be diving into this topic, the role of veterinary services in zoonotic disease preparedness. So thank you very much, organizers, for choosing this topic in your ongoing nationwide training program on enhancing livestock production and food safety through One Health approach. So before going to zoonosis preparedness in our country as a whole, so let us link the veterinary science and One Health. So because some great man has told, without understanding history, we cannot create the history. Let us understand how this One Health concept then transformed as an approach, then initiative. Now it is an order of the day. How it evolved, let us understand for 7-8 minutes or 10 minutes in the beginning. Please remember, nothing is static on the planet Earth. Earth itself is not static. There are many biogeochemical processes that will be occurring simultaneously, and environment has an important role to play, and ultimately the number one decider of occurrence of the diseases on the planet Earth. We share our environment, our livelihood comes from environment, and we live with n number of microorganisms, other species on the planet Earth. It is a cohabited ecosystem, and unless we have a harmony in the nature, we cannot think of our sustenance, our future anymore. And if you see in the recent past what has happened, human beings greed and development, in the name of development, we are damaging the environment, and this damage is these damages in the environment, we have to pay for that. That's what is. Now, these days, One Health is more emphasizingly understood than in the previous days, than our forefathers or 1 or 2 generations before us. Since the entire the story runs or revolves around One Health, let us understand what the One Health is. The previous speakers must have already by this time emphasized the role of important role of the One Health in the today's context. One Health is a collaborative effort of multiple disciplines, whether we work in local or national, global level. But ultimately, our aim is to attain the optimal health for the people, the animal, and our environment. Please underline that, our environment, because ultimately we are living in the environment. So One Health is an order of the day. One Health is a practice of the day. And we have to understand why this is more emphasizingly that has been promoted these days is the fragmented approaches or working in silos so far have not given good results. That is why there is a strength in the unity. That's why let us unite together, the animal health people, the human health people, environment health people. Let us join hands together and bring about the desirable changes. And when it comes to zoonosis, we know that approximately 62% of the known human infections are having roots in the animals. Until and unless we control the diseases in the animals, control of these diseases in the humans is impossible, next to impossible. That's why the way the boat is driven, we have to move in a unified direction by intersectoral collaboration, interdisciplinary collaboration, and joining hands together with all those stakeholders who are into their business and join, that becomes a joint venture. That's why more emphasis has to be paid for that. Planetary environment is getting polluted. There is a climate change. Unprecedented rains in the Pakistan. The Amazon rainforest, that are the lungs of the forest, we had a fire in that. Europe, that used to be frozen much of the time, we found the heat waves. These are all the testimonials to indicate that there is an ongoing environmental change, and definitely that is having impact on the vector dynamics, the disease occurrence, because our population is also increasing. About 9+ billion human population is affected by such environmental impact, including the impact on the human health. So today, One Health is more and more emphasizingly understood only because we have found some unprecedented disease episodes. Let it be the SARS coronavirus 2. Before that, let it be MERS coronavirus. Let it be the earlier SARS coronavirus. All of these infections have jumped the species in one of the animal intermediary, then to the domesticated or the livestock, then jump to the human being. Today they are being transmitted as human to human transmitted infections. So these are the emerging infections. And unless we implement the One Health principles, management of these diseases is next to impossible. So these are all shared areas of interest wherein we all, I came to know from organizers that there is a very diverse group of participants in this. So you can fit yourself in one of these activities. So it is a time to work together, not in silos, under One Health umbrella we have to work these days. The potential outcomes. If we implement the One Health approach, One Health practice, what is the gain we are going to get? We will gain the healthy people, the healthy animals, and healthy environment. That is nothing but sustainable development. Sustainable development, this generation also lives, and in generations to come also they are going to live happily on this planet Earth. For that, we have to embrace this One Health approach. We can better manage pandemics through the targeted surveillance, early warning systems, rapid response, better laying of the standards. The next speaker is going to speak about those standards. The capacity building, coordination, these are all the activities. Ultimately, they will make the life of the human being and animals which are dependent on humans on this planet Earth in a better way. That's what is the outcome of the One Health. And One Health is not endorsed by one or two agencies, national or international. It is endorsed globally, equivocally by the FAO, WHO, OIE, the environmental program, all these quadripartite and the national bodies, the supranational agencies, all of them have endorsed One Health as an approach to deal with the shared problems, including the zoonosis, which are shared infections in the nature. So many of the organizations have endorsed One Health as an approach to deal with the problem. And when it comes to the One Health, we have three different components: human medicine, veterinary medicine, and the environmental health. So veterinary medicine as a whole has huge contributions to the public health, and thereby it offers the One Health roles to deal with a problem. So One Health and veterinary science has immense contributions in this. Even though One Health is understood as an approach, many people, they think that One Health is something that everybody has to do. That's why nothing need to be done. It's not the case. And when you talk about the developments in the recent past, the working in the silos and all those things, and much of our literature is concentrated, whatever we have today is from the foreign side, and only we are aware about those things. So let us go into the bit for another 2 or 3 minutes. We'll go into the development of the health sciences or healing arts in India. Let us discuss it. India is a rich treasure of culture and health. Country formed somewhere around 28,000 BC. We had this Kumarikandam. So there was a Meru mountain range. In these Meru mountain range, there were many ancient healers who used to heal humans and animals alike. Is it not One Health? If you go and just find out in the artifacts, the animal and human bondage is as old as human civilization, which is there in pre-Indus, Indus, the Harappan or mature Harappan, including the recent one, that excavations that took place in this Gagar-Hakra river plain in the Rakhigarhi. So we have the lot of testimonials to say that there was a very close bondage between the human and the animal. So also the mythology that speaks about in this Meru mountain range that is submerged now. So there lived many healers. So among them, the Salihotra, whom we refer as father of veterinary medicine. If you talk about during that range, that time there were common healers who used to heal the humans and animals alike, and the knowledge that acquired in the human used to be applied to the animals, and knowledge acquired in the animal side used to be applied to the either way. So there was mutual benefit from each side. So let it be the pre-Vedic period, Vedic period, or the post-Vedic period, the healers were common. And they never differentiated between a human healer or an animal healer. In many of these civilizations, it is being proven. But of late, we started working in isolation. Human science developed into specializations and super specializations. We left somewhere the roots. Then came these Western people. So Western people, to note them are the number one is Rudolf Virchow. Then his student, William Osler, they made remarkable contributions, and they talked about oneness. This oneness was taken up as a lifelong obligation by Kelvin W. Schwabe, which is very much clear in his book. And later on, from one medicine, again, One Health has started bearing the fruits. So One Health is a reality for the 21st century to solve the health problems, which is evident through when you walk through the history. These timelines you are very well aware of. Hippocrates long back, he talked about the clean environment's role in the better human health in his book. And if you talk about how this veterinary medicine has emerged, the dreaded cattle disease, rinderpest, was affecting the food supply of the humans. This made Pope Clement XI he has directed his physician, Giovanni Maria Lancisi, to do something. Today we know this technique as the Lancisi's test and slaughter method. Then that led to the emergence of the establishment of the first veterinary medical school in Lyon, France. This great man, Claude Bourgelat, is the principal, and we celebrated World Veterinary Day and even the centenary year also. So many veterinary colleges subsequently they started, including the Post Veterinary College, Bombay Veterinary College, that started in the year 1886 in India. If we talk about then joined India, the 1882 itself, we had the first then India's veterinary college, Lahore Veterinary College in 1882. That is the history. And this is where our host is sitting right now, Bombay Veterinary College. This fellow, Professor J.S. Steele, did a lot of things, especially the veterinary journalism. That's why he's known as father of modern veterinary education in India. And we should thank this lady, Sakarbai Dinshaw, because the Petit Hospital was started in Bombay Veterinary College, and then was the rest all veterinary institutions that emerged in the course of time. Rudolf Virchow's this statement is very popular. Between animal and human medicine, there is no dividing line. Yeah. As such, there is no dividing line because the basic, the principles and fundamentals, what we study in one animal, any animal, or in the human, they are alike. We as a professional should not try to draw a line with our influences. That's what Rudolf Virchow says. If you talk about the one medicine and its transformation into the one health, Rudolf Virchow has done a lot of work on, even though he's a physician, his work is noticeable with respect to zoonotic agents. And he influenced his student, Sir William Osler. Even though he is a physician from Canada, so he established the North American School of Veterinary Medicine, and we honor him for his contributions. The Virchow and his student Osler's cross-disciplinary efforts are highly appreciable in the history. Then comes the Louis Pasteur's work. Louis Pasteur, even though he's a chemist, he transformed into a microbiologist, and in his life, he worked with many veterinarians, blue in color, and many medicine persons, physicians, red in color, and he co-founded the very renowned Pasteur Institute with Emily Rocks. We cannot forget this fellow, Daniel Elmer Salmon, the first chief of BAI, Bureau of Animal Industry in America, and his contributions towards the meat inspection. And his assistant, Smith, has identified an organism, isolated an organism, and in his honor, today we come to know a very important Salmonella genus. The work carried out in the babesiosis by Theobald Smith, cattle fever, that gave insight to identify the vector-borne transmission of a viral fever, yellow fever, by Major Walter Reed, and that led to the construction of the Panama's leaf. A insight from a tick-borne disease. Later on, Walter Reed controlled this vector, and since they controlled the vector, they could reduce the yellow fever. That led to the construction of the Panama Canal. Panama Canal, you know, the commercial value associated with the Panama Canal. Then comes the work of BCG. Calment is a physician and his assistant Gaurin, they worked together. They developed the BCG vaccine and the diagnostic today after several years of the subculturing and getting of the A virulent strain that today we are using as a BCG vaccine. Legendary Kelvin W. Schwabe is regarded as father of veterinary epidemiology. He is the person throughout his life, he preached the one medicine, and that we call it as one health today. His contemporary, James Harlan Steele, whom we regard as father of veterinary public health, has immense contributions, a centurion. Throughout his life, 100 years of valued life, he preached One Health. And when his Assistant Surgeon General, Joseph Montin, asked Steele what he will do after the World War is over, because there are no more horses and no more any army work that is required, then they started the disease intelligence, the disease data acquiring, and in CDC, what we talk about today. So all this zoonotic work, the beginning of this zoonosis work at CDC is by the J.S. Steele, and his later contributions to communicable and non-communicable diseases of humans, and his famous CRC handbook series on zoonosis is a masterpiece in the zoonosis. Like this, we have many examples. Some of them just I will for your information. The Johnson worked with Murphy in virology. Recently, a Nobel Prize winning One Health endorsement, Doherty with Zinkernagel, and the highest the scientific award that is given in America was given to Bristner for his transgenic work. So he's a veterinarian again. This is a veterinary contribution to the One Health. So like this, we have many contributions made towards the One Health by the veterinarians and their medical counterparts, and likewise other people. Remember Pasteur and many others. However, we are finding until recently, there was a big gap between the merger between the medical and veterinary fraternity, which has been documented in the publications of the Grant and Osline. So of late, it is proved beyond doubt that we should not work in silos. We have to come out and work together to address these shared problems. Let it be reduction of the global hunger, management of zoonosis, food safety and quality, biomedical research, including environmental protection and safety, so that the biodiversity is preserved on the earth, and in days to come, we'll have better days. So Manhattan Principles, they underscore the importance of the wildlife in the occurrence and emergence of the zoonosis. Likewise, the Berlin Principles, they talk about the eco-health or one planetary health. So in this context, we need a unified, under one umbrella, the various disciplines working together. This has been proved time after the time. So one area among this One Health is the zoonosis preparedness. So that's all about the link between the zoonosis and One Health. And now the next segment I'm going to discuss about what is the preparedness to deal with zoonosis in India, and what is the health system, and how this veterinary interventions or veterinary strategies, they are helping to combat zoonosis. That link I'll be trying to establish. So before we go into the actual programs and the schemes that are running in our country, let us understand what a health system is. Health systems and policies have a critical role in determining the manner in which the health services are delivered, utilized, and affect the health outcomes. Health is a state subject in the sense that state governments have to deal with the health of its people. So that is the requirement. Central government gives only guidelines, policies, and assistance whenever it is required to the states. That's why if we talk about India's health system, or the public health system, in other words, human health system, we have the central government, we have state government, and the local self-governments. So they all work in a unified way, and much of the guidelines, they come from the center, while the state implements, and locally these programs are available as serve goods and services to the people. This is what is the health system, the structure of the health system and functioning of the health system. The health system can be divided into 3 tiers. Tier 1 is the primary level. which is made up of primary health centers or the sub-centers, which are there at the village level or cluster of village level. The secondary level is the community health center, which encompasses several village clusters. And the tertiary level is either the advanced hospitals or the medical colleges. They are at tertiary level. In the form of a pyramid, we have these primary, secondary, and tertiary health structures. When it comes to the Indian entire healthcare system, including the hospitality and the tourism and health together, we have public institutions scattered across various ministries and the departments. And in addition to this, we have a private system, healthcare system, wherein there are multi-specialty hospitals, charitable hospitals, run by non-governmental organizations. This particular structure is different for a veterinary side. When we compare this health system to the veterinary health or animal health system, this private sector is either non-existent or almost insignificant. This is the difference. Because when it comes to the implementation of the One Health, we have to take care of, there is a larger private health sector in the human side, unlike in the veterinary side. We have at the top Ministry of Health and Family Welfare, and we have various departments in this, and it works with various authorities also, including Food Safety and Standards Authority that deals with the food, including foods of animal origin. But by and large, there is a larger private sector which is often functional, independent, using certain norms. That's it. So primary level in the pyramidal structure, we have the primary tier, secondary tier, and the tertiary tier, and cases are accordingly forwarded. Zoonoses are also dealt in this way only. So there is no separate mechanism to deal with the zoonoses in the human sector side. It is invariably a population-based or invariably the demographic or political structure of the village or district, state, likewise it is. Let us compare between the human and animal health sectors. We have about 1.3 plus billion human population, while livestock population is only about 0.5 billion, which is enumerated by the livestock census in the year 2019 by the ADF. And if we talk about the contribution of the livestock sector to the overall GDP, it is 4.11%. While agricultural GDP, the contribution of animal husbandry is 25.6%. That means 1/4 of agricultural GDP comes from the livestock sector. And this sector contributes in the form of livelihoods and also gives direct or indirect employment to the people. This is the structure of the animals. Let us see the healthcare market. Healthcare market in the human healthcare market is about 7.4 billion US dollars, while the livelihood giving sector is about just 7,000 crore is the total healthcare market. And species wise, if you see, major are livestock. Livestock means cattle, buffalo, sheep, goat. These are the livestock, followed by poultry. Then comes companion animals, aquatic animals, and other miscellaneous exotic animals and all. This is the overall share of the animals and the market. So what I mean to stress in this slide is we have a huge human sector and a small animal sector, but this sector is highly significant because it is an employment source and it is a livelihood option and it contributes to the GDP. And it is these animals who can suffer from zoonosis. And when it comes to, as we discussed earlier, unless the disease is controlled in the animals, control of any zoonotic disease in the humans is next to impossible. So just to give one example, recently the government has introduced the TB Mukt Bharat Abhiyan, Nikshay 2 program. Her Excellency, our President has inaugurated this function. Okay. So under this, they have started feeding the TB affected patients with the nutritious food. How the food can be nutritious without milk, powder, and egg? That's why it is also included. So this is what is the veterinary contributions towards the health of the people. Just to give a small example. So that's why. Then come to the next component, the animal health system also. It also runs the same way the human health health system runs. We have central government that gives the guidelines. Sometimes it funds some of the centrally sponsored programs. State governments, they implement the programs at the local level. And we have a structure something like this. We have at the central government, animal husbandry department, guided by this guides the state governments. We have state or union territory animal husbandry departments, district level units, and district level units, again, they have veterinary dispensaries and hospitals, the way primary health centers and sub-centers. So this is the structure. So at the top, at the policy or the decision making, and sometimes funding central sector programs, the schemes, we have Government of India, and we have this Ministry of Fisheries, Animal Husbandry and Dairying, and we have Department of Animal Husbandry and Dairying, we have State Animal Husbandry Department, ending with the hospitals. The central government also under the DADF has laid down certain laboratory setup, and these laboratories undertake the diagnosis and surveillance of the zoonosis. So this is the political structure. We have the ministers, and then we have the secretaries, joint directors likewise. To help animal husbandry sector, we have Ministry of Agriculture and we have Indian Council of Agriculture Research that has laid down many. Is slide is okay?
Yes, sir. Yes, sir.
The organogram of the Indian Council of Agriculture Research that deals with the research in the agriculture and also animals and animal husbandry, including veterinary. So they have one DDG Animal Science. We have various institutions, the national institutes, deemed universities. In addition to that, state agriculture and veterinary universities. So they all come under one umbrella. That is the DDG Animal Science, then ICAR, then Ministry of Agriculture. These, the mandate, if you see the vision, mandate, and the trust areas of this particular division, if you see. So at one point, the highlighted one you can see, transboundary and zoonotic diseases also, their monitoring, their surveillance, their diagnosis, including antimicrobial resistance. That is one of the trust area of the ICAR. We have several universities, institutes that deal with the different aspects. Okay, we'll discuss about some of these institutions little later. Just to give an example, what the state governments will do. The same structure is true with the state government of any state government or union territory has more or less the similar structure, a state level body, district level body, and then the primary veterinary centers, veterinary dispensaries or hospitals. If the facilities are not there, then mobile veterinary services, they cater to those places. And if at all any problem is there, that is the transfer to tehsil or taluk level organization, then to the district, then to the state machinery, then if required, that is notified to the national machinery. This is how any state government, it works like. One of the important flagship program that was started by the government of India long back is National Animal Disease Control Program, NADCP. Under this, initially, because FMD is one such disease that was affecting foot and mouth disease of animals, because there are many non-veterinary participants in this. Foot and mouth disease is one such disease that was affecting the trade. We were unable to export the meat or milk from our country because we are having foot and mouth disease, and we cannot export to a country which is FMD free. It is taken as sanitary under WTO's SPS measures. That's why. government started a program of, just like in humans, the polio eradicated, the FMD eradication program. That was the target number one, and it was affecting the livestock, especially bovines, the cattle and buffalo, pig, and sheep and goat. Then a rampant FMD control program was started in our country. Later on, brucellosis being one of the economical problem. Why it is economical? There are abortions, there is a zoonosis potential. That's why they targeted this disease, and many more diseases to come. They will be flagged to NADCP in days to come, because we have already learned a machinery know-how by foot and mouth disease. Brucellosis is the next, and subsequently other diseases. Right now, say for example, rabies control is also going on. So with the help from the NGOs and the Bill and Melinda Gates Foundation, they started to deal with zoonosis and other problems. They started this One Health Support Center. Okay, regarding that we'll discuss a little later. Okay, so when it comes to the disease control programs, major livestock diseases that are having immense economic implications, they are targeted. In addition to that, zoonotic diseases are targeted. Most importantly, tuberculosis, brucellosis, rabies, because they affect the health of the humans and animals. After the emergence of the One Health concept, so these concepts have been imbibed by many sectors, including the animal husbandry department, which is proven the way in which they dealt with avian influenza epidemics and brucellosis in the recent past, and also to a certain extent the rabies. So zoonotic diseases often they are so far they are neglected, but they are handled in silos. One thing is they are neglected. Second thing is they are handled in silos. Lot of laboratories, they generate the data. That data is locally made use of. We do not have a centralized database, even though there are some programs, they are not effective. And today we are talking about it is a data science, artificial intelligence and the machine learning, what you talk about. By doing this, we can predict, model, and even we can come to know the real-time occurrence of the disease that is possible. For all these things, we need a suitable data to be acquired, interpreted, collated, and disseminated to the people. That is what is the digital era, and National Digital Livestock Mission is one such leap in that direction. First time ever in the world. We'll discuss about that later. Okay. So we have Department of Animal Husbandry, Dairy and Fisheries, ADF. Under this, there were many programs that were running. All of them have been converted, merged into 3 developmental programs, and we have these programs: Rashtriya Gokul Mission, National Livestock Mission, NLM, Livestock Health and Disease Control, National Program for Dairy Development, Livestock Census and Integrated Sample Survey, National Animal Disease Control Program, NADCP, National Dairy Infrastructure Development Fund, Animal Husbandry Infrastructure Development Fund, and other developmental programs that support the dairy development in the country. So majority of these programs are central sector. The state governments have to just implement. The majority of the funding for these, again, that depends on scheme. Funding comes from the central government. Of late, in the sense, in the recent past, the Office of the Principal Scientific Advisor to the Government of India has done a lot of changes in the existing structure. So let it be building of the transparency or end-to-end online portals, ultimately to develop such an ecosystem which is endorsed by the One Health Initiative. So that's what is the thing which is very much appreciable in our country, and this is an unprecedented development in the animal husbandry sector in India. One Health Initiative is being taken as an approach to deal with animal diseases, because animal diseases have profound significance or impact on the human health and the well-being. So the way in humans we have the integrated disease surveillance system, just like that they have established integrated disease control programs. that includes, in addition to the livestock, the wildlife and other minor species. They created ease of doing this business. For that purpose, they have started a nodal agency known as Empowered Committee for Animal Health. So this is a central committee, that is a steering committee that looks after the progress of the activities. In addition to this, we have got National Digital Livestock Mission. So it is a very unique opportunity in India, because just like the Aadhaar, we have Pashu Aadhaar. Until and unless an animal is identified, whether it is diseased or not, how can we have the data? Okay, that's why this unique animal identification is having a role to play in days to come. And all the animals in this country, livestock, they will be tagged, and they are tagged and they are identified by a unique number, so that their movement is traced. If the movement is traced, and if this information is transformed to the livestock product, we can ensure the better export sales. So livestock, or the livestock traceability, using the novel information technology tools such as blockchain designs, all these data will be available, including the integrated disease surveillance data will be integrated, production data and health data that will be integrated, and it will be available to the user, policymaker, and the stakeholder. In that way, this blockchain design is going to help. We have enough information network for animal productivity and health under the leadership of NDDB. So every animal will be tagged, and the information linked to its productivity and the health will be available to in the public domain. It will be available. National Animal Disease Reporting System, NADRES, is already functional, wherein the concerned veterinary officer will feed the data, and we have data available with respect to livestock diseases, including zoonotic diseases. There is no separate portal for the zoonotic diseases. We have to find zoonotic diseases in a pool of the animal diseases in this. So the National Digital Livestock Mission is first of its kind in the entire world to have these health as well as productivity data that works through something like this, the LIVESTOCK. Likewise, there are breeding programs, the artificial insemination and other things, and beneficiary maintenance, beneficiary identification, and end-to-end interface they have created. So in this, we have active and passive surveillance programs. And one of the important component of this NDLM is eGopala. It has many components, but it also has the information related to the zoonotic diseases, brucellosis, TB, rabies, influenza, anthrax, and the One Health principles it works on. Okay. So this is eGopala. You can both mobile as well as the PC-based interfaces are available. Every farmer can download this. This is highly user-friendly, and it is even made available in local languages also. So the things are going on. So off late, taking the inputs that are going on in the contemporary world, One Health has been imbibed by this Department of Animal Husbandry. They have started how to implement practically the One Health into the animal husbandry. The result is the One Health Support Unit. One Health Support Unit is one such program that is a pilot program initially implemented in 2 Indian states, Uttarakhand and Karnataka. The lessons learned, the modifications made in this, in due course of time, they will be implemented across the country. And they have constituted a committee, Project Steering and Empowered Committee on Animal Health. They all monitor this success of this program. So ultimately, we will have a better roadmap to deal with the infections, including the zoonotic infections, and One Health components integrated into that. So One Health Support Unit is one such interface for single window coordination, lab networks, because earlier labs were not networked. whatever the information that used to be generated in the labs was only for the local use. So after the introduction of all this NDLM, so we have the laboratory network and digital disease report and response system and customized training modules for the people who are into this business or the stakeholders, communication for the stakeholders or the policymakers, strengthening of the biosecurity, because it is very important. Recently, we have seen the lumpy skin disease, African swine fever. Earlier, we have seen the porcine respiratory and reproductive syndrome. All of them, they were never there in our country, but we got it from the other countries. The transboundary diseases. In that perspective, we have to have a shield across a country at the borders of the country, so that we can protect our country and livestock from the ingress of the infectious diseases, including zoonotic diseases. In that way, biosecurity is also a very important aspect. They will be dealt under this. Let us go into bit details of the NADCP program that we have. NADCP is it is a program, flagship program of the central government, launched in the year 2019. And initially, foot and mouth disease was the disease. Now, recently, they started the brucellosis. 100% bovine of this country, aged between 4 to 8 months, they will be vaccinated with this Brucella abortus strain, yes, Delta per strain. That is a vaccination program, so that we know that brucellosis is an economic disease and it is a zoonotic disease. For that, modalities have been laid out. I will not go into details of the modalities, how it is implemented. Prophylactic vaccination is one such program. Second is the strengthening of the existing veterinary dispensaries, hospitals, and establishment of new veterinary hospitals. That's what is a very important task. And the third is the assistance given to the states for the control of the animal diseases. So the trainings are imparted, the practicalities and the practical modalities to handle zoonotic diseases such as influenza, anthrax, rabies, etc. That exotic diseases, transboundary diseases, those modalities have been worked out under the ASCAD program, because we cannot teach this only to the students of the universities and the colleges. Ultimately, it has to be implemented by the veterinarian, government veterinarian working in the field. So they have to be imparted these trainings, the veterinary staff, the para-veterinary staff. So in that, there is an HR component also under ASCAD program, and many of the state governments, they run ASCAD program with the assistance from the center against the dreaded livestock diseases, including the zoonotic diseases. So call centers have been established. They deal with many animal-related complaint registering, including the zoonosis. So one more important component under the NADCP and the central program is creation of the disease-free zones. India is a vast country, from Kashmir to Kanyakumari, from east to west. If you see various the climatic zones, if you talk about, so some diseases are localized, some diseases are omnipresent in the country. So that's why we have to create the disease-free zones, so that we can export the products in a better way, we can handle the livestock in a better way. In this context, they started this ring vaccination program initially to the semen stations, frozen semen stations, because artificial insemination of the bovines is an important developmental activity related to animal husbandry. So at least 10-kilometer area surrounding such stations, semen stations, they should be disease-free. They are vaccinated against the livestock diseases and zoonotic diseases. This is going to realize our Animal Act, the Prevention and Control of Infectious and Contagious Diseases in the Animals Act. So disease-free area or disease-free zone creation is one of the important activity. Guidelines have been phrased and they are implemented for the import and export of the bovine germplasm. This is very much pertinent in the event of the transboundary diseases and their entry into the country in the recent past. So modalities and various annexes have been created under this, and it requires a license and permit to ship the animals into or out of the country, so that the diseases won't migrate from one country to the other country. We have minimum standards and SOP for bovine breeding, because majority of our breeds, our farmers, they tend to indiscriminately breed these animals, and during natural services, there can be sexually transmitted diseases. They can be transmitted to the cows. In that perspective, control of sexually transmitted diseases and the zoonotic diseases, there have been modalities that have been put forward. So major diseases that are covered are brucellosis, tuberculosis, Jones disease, trichomoniasis, campylobacteriasis. These are important zoonotic diseases that have been covered under the minimum standards and SOP for bovine breeding. And you can see here, there is a compendium of minimum standards of protocol and standard operating procedures for bovine breeding that has been published along with its annexures. Who will conduct the test? What has to be done with the animals that are tested positive? How long the animals must be negative? So if the health status of the animals is unknown, what need to be done? For cows, what need to be done? For adults, what need to be done? Who will test? How they will test? Where they will test? So all these modalities have been written and they are available in this particular document. So in addition to this, we have an address system, National Animal Disease Reporting System, wherein data is digitally acquired from the source and is transmitted, and it is available to the stakeholders and the policymakers. So NADRES 2.0 system is now it is available, and Central Disease Reporting and Monitoring Unit takes care of these things, and they have advanced information technology tools to deal with these things. The NADRES app. You can see, just to give an example, we can know how many brucellosis vaccination have been taken place. So that's the reality. That is the reality after the implementation of the National Digital Livestock Mission. Earlier, this was not available. How many animals are vaccinated? How many farmers registered? How many? All that information is available. If a farmer he's interested to take the productivity data, that is also available. Since it is out of scope of today's discussion, I have not included that one. Gopala is there, and it is linked to the BMAP and many things that are there in place. One of the thing that is linked related to today's discussion is NADCP data that is linked to the NLM and then Pardon?
Please do not talk in between. All the participants, please mute your phone. Mute your mobile.
Another 5-6 minutes, please. There. So enough is one such platform, the digital platform. So that has integrated into it both productivity data and the health data. So many are from the industry. For you, it is highly useful. How? There is a ear tag on the animal. Say, for example, a sheep ear tag is there. That will be, in due course of time, that will be transformed into a product. So you will come to know where the animal born, who reared, who is the owner, how it was shifted, and in which plant the animal was slaughtered. All that information you will have in due course of time. You will have the information related to that, and that's going to promote the trade. So probably for the first time in the world, okay, such a health and productivity integration of the data is possible in India by these recent interventions. So let us take only these points at this point of time. The treatment data, which antibiotic was given, all those things. What was the diagnosis? What is the test? What was the outbreak and other services? So they all will be available in a single platform. The second, one more important activity is the animal quarantine and certification services. We recently, you know, that cheetahs have been brought to India. So likewise, livestock also they are treated. There are a lot of regulatory requirements under International Zoo Sanitary Code of World Organization for Animal Health, earlier OIE, and we know that listed and non-listed diseases, especially the listed diseases by OIA. So we have to follow certain procedures. For that purpose, we have animal quarantine and certification services. In One more important platform is the sanitary import permit system for livestock products. This has been imposed because we have Livestock and Livestock Products Importation Amendment Act 2001. There is a need for freedom of the diseases. For that purpose, this particular facility, that is a sanitary import permit system, that is functional, and at various places you can go through the website for the details. So various the things have been defined there. The animal is defined, the animal product is defined. What are all the animal products that are there? They have been defined there. So they will be again helping the trade of foods of animal origin. There are many state governments. They also, in line with the central programs, they have imposed certain programs as state-sponsored programs, or sometimes they are integrated with central also. Just to give an example of the government of Karnataka. So state, obviously, there is a central brucellosis control program going on. State also does its activity in line with the central. And the helplines have been created, 24/7 helplines have been created. They deal with many productivity and health related information. Zoonoses are also included in this. Zoonoses are not dealt as a separate entity. They are along with other productivity and health information of the data. Country has laid down a huge network of laboratories. So under the aegis of the ICAR, we have National Institute of High Security Animal Diseases in Bhopal. We have ICR Nivedi in Bangalore, and many national research centers. One such pertinent to the zoonotic diseases is ICR NRC Equine CSAR. Then we have IVRI, and many universities have established certain referral laboratories. So in this, our university has established one rabies referral laboratory, which was initially twinned with, and now it is a OI referral laboratory for Southeast Asian countries for rabies. So that's there. Likewise, many universities have other laboratories. Not only this, many universities have other laboratories in place. They deal with zoonosis. Then we have as a certifying body, National Institute of Animal Health, and the network of the laboratories, the disease diagnostic laboratories. We have a central disease diagnostic laboratory located in Cadrat, Iverai, and 5 regional laboratories to meet the requirements of the different regions of the country, the east, west, south, north. In different places, we have the laboratories. They work with animal husbandry departments of the concerned states. They report the diseases, transboundary and zoonotic diseases, and likewise, the information that passes to the DADF, and at a country level, the action is taken with respect to a particular transboundary or zoonotic disease. So some, what we can say, the bullet points with respect to these institutions. We have National Institute of High Security Animal Diseases, NISHAD, at Bhopal, Madhya Pradesh. Earlier, this was established as a regional station of IVRI Izzatnagar as a high security animal disease laboratory, but now it is a national institute established in the year 2014 that deals with many exotic and emerging diseases of the animals. Many of them are zoonotic in nature. You can see the highlighted bullets here, diagnostic services that are rendered by this. They have BSL 3+ facilities or BSL 4 biocontainment facilities, and the diseases of very high pandemic potential or high priority, they are dealt with in this institute. We have Nivedi here. Mostly it is dealing with the disease informatics, and they have one more NADRES system. They deal with the development of the disease maps, disease epidemiological surveillance of the diseases or the pathogens in livestock, wildlife, all those things they are taken care of by this Nivedi Institute, which is a national institute under the aegis of ICAR. The Nivedi is having this this system, okay, National Animal Disease Referral Expert System, NAD-RES. Again, they have started version 2, and all the data acquired is collated and is processed, and ultimately the disease maps are developed with respect to occurrence of a disease, and even they will give the prediction in their website. You can just go through the details. So which month, which disease is expected in a particular season, in a particular month. Likewise, they will give the information. So disease prediction, forecasting, early warning, type of data analysis based, information based information is available with an address of ICAR Nivedi. So the disease diagnostic laboratories, the central is located at Iverai, Cadrat, and we have these 5 regional disease diagnostic laboratories. Just to give an example, in Karnataka, under our university, we have this Institute of Animal Health and Veterinary Biologicals in Bangalore, which is also a southern regional laboratory for the disease diagnosis of animal diseases. It covers many states. Likewise, we have northern region at Jalandhar, northeastern in Guwahati. This particular institute, recently that is being renamed Chaudhary Charan Singh National Institute of Animal Health. It works under the central government, and it recommends or licenses the veterinary vaccines. So all the vaccines, biologicals, the diagnostics, they have to undergo the quality control check, or the standards, whatever they are laid down for them, have to be complied. And for that purpose, this particular institute works. And recently, whatever the brucellosis vaccine that is available for mass vaccination of the heifers has been one such endorsement from this particular institute. We have National Institute of One Health. It is yet to become a reality. So we should thank the MAPSU for taking a lot of efforts in this direction. So MAPSU, along with ICMR, ICAR, with their joint effort today, the central government has announced the National Institute of One Health. Initially, for some years, it's going to work under NIV Pune as a satellite center, and afterwards it will be full-fledged activity. And this One Health institution is going to spearhead many of the zoonotic diseases in days to come. Let us hope and pray for that. So in nutshell, we have to change our focus from anthropocentric or human health centric to zoonosis centric. So because many of the infections are having zoonotic disease infections, they are having the roots in the animals, and control of these diseases in the animals is going to help the human health, promote the human health. And unlike the human health sector, where there is a huge investment, so animal health sector is deprived of such investment. In days to come, we have to foresee that such investments, they do occur there. And when you talk about the veterinary education in a minute or so, our veterinary education is governed by Veterinary Council of India by an act of parliament, while the postgraduate education is governed by the Indian Council of Agriculture Research. There are efforts to make a unified structure. Let us see what's going to happen, because undergraduation by one council and post-graduation by other council, it is something disparity. In days to come, we'll get a better unified system to deal with veterinary education in India. It is unlike Medical Council of India. In Medical Council of India, a single council deals with undergraduate and postgraduate education. Veterinary setup, if you talk about in India, so we have about 12,000 veterinary hospitals and polyclinics. There are many states which are not having even 200 veterinary hospitals or polyclinics in the entire state. So about 70,000 veterinarians in this, they are graduated from 55 veterinary schools so far, 55 or 58. So around 17 veterinary universities, and rest all they work still with the agriculture universities. This is a veterinary education setup, and then followed by veterinary or animal husbandry setup. It is there. But to deal with huge animal species, livestock itself, to deal with 300 million bovines, we need 60,000 doctors, veterinary doctors, only for bovines. How about other animals, the poultry, sheep, goat, pig, and other pet exotic animals? and we have to have the veterinarians to be employed in veterinary schools, institutions. So if you talk about all this, so there is a dire need of veterinary graduates and veterinary employment, so that they can deal with the animal health, and then they will focus on genesis. So these are all the places where veterinarians they are working. Again, this is a report from a newspaper. So their first priority is to work in state animal husbandry departments. So to deal with the productivity related activity, and when we want to transform it to the health and that to zoonosis, we really need to look forward for better employability, better employments for these veterinarians, so that they will take care of animal health and then they are available to take care of zoonosis. With this, I want to conclude that veterinary profession immensely contributes to the health of the humans, health well-being also. We have recently seen the contributions made by some of the veterinarians and veterinary institutions for the COVID management, which is a testimony. But still, we have to go a long way, because under NADCP, only few diseases are covered. There are huge number of diseases still they are available in our country. They need to be tackled by blowing this NADCP to other diseases, or including the zoonotic diseases. So with this, let me thank you. As the father of our nation has rightly said, any country's morality depends on or is judged by how they look into the animals. So we have a very glorious past, and the future needs one health. For that, whatever the in whatever capacity we need to work upon, and we need to contribute in whatever the capacity and whatever the bit we can contribute to the promotion of the one health. That's what is the message out of this topic. Thank you, Gender sir, and all organizers.
Uh, thank you, sir. Thank you, sir, for your very nice and vast presentation which you have given. So I think several of us may not be knowing about this much of facilities or institutions which are working in the area of One Health. So, like you have given a very vast introduction about the link between the zoonosis and One Health, the ancient links which are there, and from the ancient time itself, it was known that the health is one, and you have very nicely elaborated all these linkages, and then very nicely you have elaborated the different agencies and the institutes which are working under the One Health, or they have the facilities for the One Health, like that. Like you have very nicely you have explained the phonogram of that. Yeah, then National Animal Disease Control Program. Then you have also explained how animal husbandry departments of the different states they are working for in the area of One Health. And then very nice, you have elaborated the different schemes which have been started or initiated by the principal scientific advisor of the government of India, like One Health initiative and other initiatives. Then you have mentioned about the National Digital Livestock Mission, which is working for the disease surveillance and an animal disease reporting system. And you have also elaborated this One Health Support Unit by Department of Animal Husbandry and Dairy, which is a single window coordination activity can be where single window coordination activity can be done. Then you have also explained about the various other schemes for the animal disease control, like you have explained about the minimum standard for the bovine breeding and how this ring vaccination has to be done in order to control the different diseases which can be transmitted through the semen, like brucellosis. Then you have also very nicely explained about the National Animal Disease Reporting System and Information Network for Animal Health Productivity and Health, which is an initiative of the NDDV. And then you have also mentioned about the animal quarantine and yes, animal quarantine services, which is an initiative of the government of India for the animals which are imported in India. And then you have mentioned the sanitary import permit system with for the livestock products. So and you have also elaborated the various state sponsored program and the different institutes like Nivedi, different diagnostic laboratories of the government of India throughout the India, and the National Institute of the working of the National Institute of Animal Health, their role in controlling the diseases, and their role in One Health. And then you have, in the last, you have also elaborated about the plan for the National Institute of One Health, which has to be established with the help of ICR and ICMR. So, sir, you given a very nice presentation, very exhaustive presentation. All of us have enjoyed a lot of information you have given to us. So now I request the participants, if they have any questions, any queries, so they can ask directly to the sir, or
No.
they can write in the chat box also.
One question in the chat box, if you permit, shall I take that?
Yes, sir, sure, sir.
This is by Dr. Nanda. He's asking many times. So we need to work with these IAS officers and the bureaucrats. So gone are those days wherein there used to be programs and we had to implement them. But these days, with the support from PMO, especially the One Health support unit, and there are many people there to the well-learned people to the principal scientific advisor office. So whatever the information, if you discuss with them, so they will be taken to the office. Then that will be discussed with the bureaucrats, such as IS officers. Then it will be implemented. So especially the One Health support unities, the concept that is like that. So if you see that, so in this context, we should appreciate the efforts made by Dr. Ganapati Sindura after his joining of this particular office. Lot many such developmental things they happened because of the interventions in that perspective.
Any question? Anybody?
Hello, Dr. Nagappa.
Yes, sir, please.
This is Dr. Dalvi.
Sir, namaste.
Namaste, doctor. I congratulate you first. Such a good, informative, and nice webinar, or what you call it, as a lecture from you. Really, it is. I enjoyed this. Your lecture was so informative. You have not kept any stone unturned regarding the health programs about zoonotic diseases. I have only one question. You can say it is a doubt. I want to know what is reverse zoonosis, and any program it is there in respect to this national program, or the program with the medicos. So just I want to know this.
Okay, sir. Thank you very much, sir. Sir is one of my mentors personally. Okay, sir. There is nothing like reverse zoonosis. If you see the zoonosis definition given by the joint FAO, WHO, and then joined by OIE, all those diseases and infections which are naturally transmitted between human and animal. Disease cannot be transmitted. It is an agent of them. They get transmitted. That is the definition of zoonosis. But for our understanding, we divide the diseases into these infections into two. One is those diseases that invariably we get from animal or animal reservoirs. We call them as anthropogenosis. And the diseases of humans, wherein animals get infected, we call them as zooanthroponosis. Some people, they call human to animal transmitted diseases, zooanthroponosis, as reverse zoonosis. It is only a colloquial or what we can say daily use. That's all. But as such in the literature, whether the disease is transmitted from human to animal or animal to human, all are covered under zoonosis only. There is nothing like reverse zoonosis. But for the sake of understanding, some people colloquially, locally use this term. That is the etymological part. When it comes to the any national policy or any national action that is being undertaken right now to deal with the human to animal transmitted diseases, it is not there, because zoonosis are dealt as one of the disease among the livestock in animal side, and in human side one of the diseases. Just to give one example, tuberculosis. We know that human type of tuberculosis caused by Mycobacterium tuberculosis is transmitted from human to human. No animal is involved. So humans, they consider, physicians or human side, they consider this as non-zoonotic. If at all any animal that comes in the transmission pathway, it get affected. Then we call the human type of tuberculosis as the reverse zoonosis.
Okay.
On the other hand, the bovine tuberculosis, which is a classical zoonosis, it is transmitted from one bovine to the other bovine. Human will get infected by Mycobacterium bovis. There is a possibility they consider this disease as anthropogenotic. So this is only a play of terms. Otherwise, zoonosis, whether it is human to animal or reverse, they are zoonosis only.
Okay, good. Okay. Thank you so much.
Thank you, sir.
Hello, good afternoon, Dr. Nagappa.
Sir, good afternoon. How are you?
Fine, thank you. Very wonderful presentation, and all the information you have updated to all the participants. Very excellent presentation, Dr. Nagappa. Whatever this role of different organizations, or miss that is in veterinary services under One Health umbrella that you have highlighted, and that is the need of the hour, that we have to update the knowledge of all the participants, and that will be definitely beneficial to all the PG and PhD students. Thank you very much. The important thing is that because you are in under miss emergency call, that you have accepted our invitation, and within 2 days you have prepared very nice presentation. Thank you on the behalf of our organizing committee. Thanks a lot, sir.
Thank you, sir.
Okay, Dr. Nagappa, excellent presentation. Congratulations for that. And special thanks for accepting our invitation at the 11th hour. So I'm ready to accept, and today you have presented very nicely. And this is very much communicated to all the participants, and they have enjoyed your talk. Thank you so much. And we hope the same, but we'll be informing you in advance. Okay, hereafter.
Thank you, sir.
Okay, thank you, Dr. Nagappa. So we'll move on to the next speaker, Dr. Vaidya, please.
Yeah. So good afternoon, all dear participants, as well as the speakers. Today we have second eminent speaker, Dr. Nilesh Amrutkar. He is working as Managing Director, EnviroCare, Thane, and uh, sir is going to deliver his talk on standard specification for setting up basic food analysis laboratories. Uh, Before I invite and request Dr. Nilesh Amrutkar sir, I request Dr. R.J. Zhende sir, who is the course director of this 4-week certificate course training program, and PI and professor and head Department of Veterinary Public Health, to give brief introduction about our today's second speaker. Zhende sir, please.
Okay, thank you, Dr. Vaidya. Uh, Good afternoon, everyone. Am I audible? Hello? 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 Am I audible? All the participants, I'm asking you.
Yes, sir.
Okay, thank you so much.
Yes, sir. Yes.
Okay, thank you. So,
Yes, sir. It's audible.
good morning, everyone. So, I have a pleasure to introduce my very close friend, Dr. Nilesh Amrutkar, is the Managing Director, EnviroCare, and today is speaking out the standard specification for setting up the basic food analysis laboratories. So, Dr. Nilesh Amrutkar is a PhD in the microbiology from the Institute of Chemical Technology in Mumbai, and is currently the managing director. He is having his own lab as an EnviroCare in the Thane. He is working in the field of testing, inspection, certification of food, environment, pharma, and consumer product since last 25 years. Dr. Nilesh has been instrumental in getting his lab accredited under the ISO 17025 2017 and ISO 17043 by Enable, that is for the PT providers, and approved by the various regulatory agencies of India, that is MOEF, MOFTI, FSSI, FDA, BIS, EIC, APIDA, ACMARC, and GAPTA, UK. So all these regulatory bodies, they are accredited in his lab, and you can see the kind of services is providing to all the testing laboratories of the customers. He has many publications in the national as well as the international journals, and has presented scientific and business lectures at many events across the globe. And I was one of the person to listen to his various lectures in the various forum. Dr. Nilesh holds key positions in the various association bodies such as AFSTI, and is on the board of various scientific representations at FSSI, FDA, and BIS. He is impaneled assessor with the Enable India as well as the UAE accreditation bodies. He is a program in charge at the Center for the IGNU Postgraduate Diploma in Food Safety and Quality Management. Dr. Nilesh is a recipient of many awards, including the Squash Award of Merit Awards 2015, Young SME Value Creator Award in 2018, and Outstanding Entrepreneur Award in the year 2019. Dr. Nilesh has also established the foundation which closely works on the United Nations Sustainable Development Goals by interacting the Penang South Reclamation Project, that is PSR, and corporate society responsibility, that is CSR, for a sustainable future. So with this a brief introduction, you can make out the knowledge he is having, Dr. Nilesh Amrutkar, sir. So besides some of the also the contributions he has made as an reviewer and editor services for the peer-reviewed journals of the national and the international repute. He, he has also attended various national and international conferences at the various forums and delivered the talk on the food safety aspects. So, this so a short duration, I invite Dr. Nilesh Amrutkar, is managing that Thane, to deliver his talk on standard specifications for setting up the basic food lab analysis laboratory uh, at our various institutes. So I call upon Dr. Nilesh Amrutkar, sir, please.
Okay. Before
Sir, my voice is available to you, or is it clear?
Yes,
yes,
you are
sir,
very
yes, sir.
clear, very clear.
Okay,
Just
very
for
clear.
1 minute,
Okay,
sir.
ठीक है.
Just, yeah, sir. Just for 1 minute, I request all the participants, please start your video for group photo. All the participants are requested, and speakers, please start your video for group photo, please. Yeah. Okay, thank you. Sir, please start.
Hello.
Sir,
Hello.
please share your slides.
Oh, okay.
Yeah.
Are you able to see my slide? Hello?
Sharing.
Slide दिख रहा है क्या?
नहीं, it's not visible.
अभी? I think now it is visible.
Not, yeah, now it is. Now it is visible.
Okay, great.
Yeah.
Okay. Okay, so a very good afternoon to all of you. And today I will be speaking on setting up a basic food testing lab as the topic. And I would like to thank the ICAR and the authorities who have developed this coursework. 4 weeks certificate course is actually a very long duration. And must compliment the organizers to come up 38 speakers and 2 participants. I don't know how many number of participants are in this program, but really a great two efforts that are being taken by the organizers. So thank you very much. And I will start with my presentation immediately. Thank you for the introduction also, sir. Yeah. So the slide is moving, right?
Yes, yeah. Yeah, it is moving.
Hello?
Yeah, slide is moving. Hello.
Okay. So if I can just get some sort of connect that. Okay, great. So let's have a look at the overall. Hello. So voice is audible.
Yes, sir.
Hello.
Yes, sir.
Okay. So to have a look at overview of the overall labs in India, there are about 224 testing laboratories which are recognized by FSSAI. From which around 53 are government labs, 155 are private laboratories, 26 are government primary test labs, and 20 are government laboratories. Apart from this, there are other labs also, which NABL has accredited 239 labs. And as per MOFPI, there are 726 labs in the country. To help this food testing lab, there are some few more government labs which are called as water labs or Jal Jeevan Mission labs. And there are 2,000 labs already in by December. They are expecting to have 6,000 laboratories across India only to analyze water at every district level. So in food testing, what do we do? In food testing, there are chemical contaminants. In food, there are chemical contaminants or biological contaminants, physical contaminants, and they need to be analyzed for the presence of these contaminants. Like example, in meat and milk, poultry, livestock, we have antibiotics, or we have heavy metals, or we have pathogens present. There may be some physical contaminants also present during the processing of the livestock. So all this needs to have analytical backup support from the laboratories. When these livestock are processed food, we have to add a lot of food additives. We have to package the foods, and there we have to comply to the label requirements, where nutritional labeling is to be given. Shelf life of the product has to be tested for, wherein called as dynamic shelf life studies also by certain food business operators. We have to do sensory evaluation, uh, physical at the food product, such as your uh, after taste or taste, or the
Dr. Nilesh,
texture, the feel, the mouth feel. All these are the smell of the product.
Dr. Nilesh, slightly there is a break.
All
in your
these
voice.
are the sensory type of. Hello.
Dr. Nilesh, slightly you can switch off your video.
Yes.
Because there is a slight break in your voice. You can switch off your video.
Okay.
Yeah.
Okay, I'll do that.
Yeah.
Yes. I'll do that.
Yeah. I think there must be some internet connectivity problem.
How do I switch off
Your
my
video,
video?
your video you can switch off.
Yeah, I'm just trying to switch off my video. I'm just seeing how I switch it off.
At the bottom, you can see at the bottom of the slide, there is a video icon. On your laptop.
On the laptop, I'm not getting any.
Sharing केलं दिसत नाही?
Okay. 1 minute. Stop video.
Yeah. Yes. Now we can
Yes,
see.
now the voice is clear, sir.
Yeah. Clear. Yeah.
Okay, great. Okay, thank you. So apart from all these parameters that need to be analyzed for in a laboratory, food testing laboratory, there is also requirement of doing GMO analysis, allergen analysis, meat speciation analysis, packaging material analysis. There are regulations in India now for packaging material. So earlier it used to be only the migration test, but now they have made more specifications like the heavy metals in the migration test. Plus there would be new additions coming up with respect to phthalate analysis or bisphenol analysis also. To do all these things, we require a laboratory, and for this particular presentation, I have used the document published by FSSAI on setting up of basic food laboratory in July of 2021. So that's the background of reference material that you can also go through later. I'll be, of course, giving my slides to the organizers so that they can freely circulate to everybody. On top of it, you can also follow us on our LinkedIn platform, where we keep on giving out the information about various aspects of laboratory regulations in food and various food categories. So setting up a food testing lab has got around 7 major components, which involves right from selection and identifying the land and building and the way the laboratory will be constructed. What would be the civil part, what would be the instrumental or mechanical part, electrical, plumbing, piping. All this constitutes one very important part of setup of the laboratory. And this is very important because once the lab is set up, if you have to do any change in the laboratory infrastructure for the specific parameter or the instrument that you are going to install, it will become very difficult post the lab gets operational. So you have to plan your laboratory well in advance, developing an organizational structure and assigning the responsibilities to each individuals, selections of the analysis to be performed. So when you are setting up a food lab, it is not that you start a food lab and then you say that, okay, we will be doing these parameters. You have to actually have the parameters and the instruments, equipment required for that analysis first, basis of which you will design the flow of the laboratory. Selection and purchase of equipment, chemicals, appointment of qualified staff, the number of staff that you would require to have to run the operations of the laboratory. Earlier, the general concept was that anybody can put up a laboratory. Anybody can put up a laboratory anywhere. If they have some small space, they can put up a lab over there. If they have some amount of money with them, they can put up a laboratory. But no, nowadays laboratory is an industry in itself. And if you ask me, for my laboratory that I have set up in Mumbai, in Thane, which is catering to more than 3,000 live food business operators and more than 15,000. It is a cost of crore rupees. You can imagine that is almost an industry in itself. You can have an industry set up at around 40 to 50 crores of rupees. So establishing the standard operational protocol or the working procedures These are part of the document that you need to maintain and submit to your NABL accreditation application. The document mentions that you need to apply within 6 months of setting up of food testing laboratory, or you will get an accreditation within 6 months. But believe me, it is not that simple. You can of course send out the application within 6 months of setting up of the laboratory, but getting an accreditation is a highly technical process, which the time will depend on the technical competency of the laboratory. If certain technical competency is not available with the laboratory, there is a non-conformance, it will take more amount of time. So what are the general requirements? You can see in this picture what I was talking about. The laboratory, this laboratory is around 50,000 square feet of lab, 6 floors, and each floor is dedicated to one particular work function, such as a wet chemistry lab, instrumentation lab, microbiology lab, sample processing lab or sample incoming lab, administration of the laboratory, storage of and utilities of the laboratory. So these are the various floors at which dedicated work is happening for running operations of the laboratory. And very proud to tell you that this particular lab is India's first IGBC Platinum certified green building for research and testing purposes. So the area or the location, the document state that it should have good access to the road. Now, of course, this is not in our hands, but within the premises, it is in our hand. Located separately from the building of production, from various chemicals or hazardous operations that are happening, should be adequately equipped with all types of necessary equipments or instruments that are required, including the lighting, safety norms, fume extractors, good ventilation. It should provide a secure and a safe work environment for the people, which will be not only comfortable but would be energy efficient, energy conservation, and would not have much impact on the environment. So these are the guidelines which are prescribed in these documents for setting up a basic lab structure. Let us understand, when we are designing this lab structure, let us understand the flow of the operations of the laboratory. So you receive the sample, you acknowledge the sample, you verify the sample TRF, that is the test request form, you check the seal. If everything is in order, you give it an internal code. Once that internal code is documented within your LIMS, so in our case it is LabRadar 2.0 that we use as our LIMS process, the software will give a code to that particular sample, and then it will be sent out to the individual section depending upon what parameters need to be done, whether you want to do microbiology or you want to do only chemical parameters or you want to do only pesticides or antibiotic residues or heavy metals. Depending upon that, the sample would be sent across to various departments. Once the analysis is done, or once the sample is received to that particular lab, feasibility, who will do, how it will be done, by when if the results will be given, how the sample would be prepared, who would perform the analysis, how the raw data would be consolidated, who would review the raw data, the authorized signatory will review the raw data, right? And then the report will be prepared. After the report preparation, there will be authorization. And once the authorization of that report is done, it will be sent across to dispatch. So you can see that there are almost 10 different departments, minimum 10, involved in the successful operation of a single report that is being issued by the laboratory. And each of these departments will have sub-departments or sub-sections.
Sir, your voice is not audible, sir. Hello, sir.
Hello.
Now it is okay, sir. Again, sir, some problem is there.
Hello. Okay, okay. So what I was saying is that there are 10 different departments wherein you will be sending across the sample for a successful report issuance. Am I clear? Any questions till now?
No, sir. No, sir.
Okay, great. Great. So, sir, tell me how many participants are there for this program today?
Sir, actually, around 500 participants they have registered, but at present we have 147 participants. And this includes faculties, students, scientists,
So that was
PG students.
okay, okay, okay. Great, great. So I think first session was of Dr. Rinde, right?
No, sir. First session was by Dr. Nagappa. Dr. Rinde, sir, because of some problem, he was unable to deliver his lecture. So another
Huh.
speaker, instead of Dr. Rinde, he gave the talk.
Okay, okay, okay. Great, great. Okay. So now, up till now, there are any questions by anyone? Maybe you can put the sample receipt and registration.
Sir, again, you are not audible, sir.
Will go across the sample storage. Spotify is available here. My voice is there.
Yes, sir. Yes, sir.
Okay, okay. So intermittently the voice may go off, but my slides are self-explanatory. I thought about this because when I was told that there will be 500 participants, there could be challenge of Wi-Fi connectivity. So most of my slides are self-explanatory. So I will be available for questions even after the training session is over. And you can connect to me on my email ID as well as on LinkedIn, wherein I can answer your queries or concerns. Coming to that, there are different laboratories in a food testing lab, like a heavy metal lab or a pesticide residue lab or general gravimetric volumetric lab, nutritional evaluation lab, microbiology lab, instrumentation lab. So all these have some specification. Like example, sample receipt area will be about 500 square feet of place. It should have weighing balance. It should have proper tables and chairs. It should have a thermometer, an upright freezer to store the samples when they come. Sample receipt area. It will again have similar facilities, but in addition to it, it also have the concept of the surveillance camera, so that the samples would be have a processing or the sampling preparation lab. So you see over here, I have shown a concept of
Doctor, you are not audible.
sampling, which you will require proper place, tables, around 500 square feet of place, and of course the general equipment for sample processing, grinders, sieves, sample splitter, drying oven, balance, etc. The air in this room should be removed properly, so that there is no odor that remains in the area. Like example, when you are doing lot of spices or you are doing lot of meat and fish products, lot of odor will remain there. It needs to be removed from that area. So HVAC system plays a very important role. Approximate and analysis area. So this is the area wherein around 600 square feet of lab, wherein all the quality parameters of the raw material would be done, which includes moisture, ash, insul ash, acid in weight, volatile oil, etc. So this lab will have different activities like digestion, filtration, distillation, titration, extraction, etc. A very typical chemical laboratory. Likewise, there is a nutritional evaluation lab, which will be more or less the similar kind of lab what you have in proximate general analysis area. But here, in addition to it, it will have some sort of instrumentation also, because nutritional evaluation will have cholesterol, vitamins, and mineral contents to be analyzed for. It will be about around 600 square feet of lab. So here the specifications are prescribed in this particular standard document given out by the FSSAI, which overall tells us that a good laboratory, basic laboratory, should have around 8,000 to 10,000 square feet of area. Another lab is your sample preparation or a pesticide residue mycotoxin laboratory. This will be about 400 to 500 square feet of laboratory. And the equipments would be related to filtration, nitrogen evaporator, rotary evaporator, centrifuges, refrigerator centrifuges, vortex, ultrasound. Few modes play a very important role, because you are going to handle lot of organic acids, organic solvents, as well as very corrosive residues standards like pesticide standards. So this particular lab is sort of a dirty lab, also called as a dirty lab, because the amount of sample that you would be taking initially is about 2 kgs to 5 kgs, out of which you are going to do a sub sample which will be only 10 grams or 1 ml of sample. The instrumentation lab are two types of instrumentation lab: the organic lab and the inorganic lab. Now these labs are very high end, very sophisticated labs, and would require maximum cleanliness, dust free environment, would require very specific temperatures, humidity controlled, and big operations. So generally it is said about 1,500 square feet of lab would be required for each of these instrumentation lab. It will have your GCs, it will require air conditioners, and they have mentioned as cassette air conditioner, because cassette air conditioners are much more sensitive to maintaining the temperature, plus they will have minimum amount of uh, what do you say, breakages or lockdowns. A very important part in an instrumentation lab would be purified water system. So for example, when you are preparing your solvents for HPLC, you require lab water type 2, type 1 water, which is a very high-end water system, like the Milicu water system. Instrumentation lab, the man has about 50 to 100 square feet of laboratory, dust-free controlled environment. Even where inside this lab, the machines are so sensitive, they will be able to detect even PPB and PPT level of heavy metals that will be carried out through your shoes, dust or the dust from your shoes. These all instruments are also sensitive to voltage fluctuations. So the power that will go to these particular instruments will have to be very, very controlled. And if it is not done so, the chances of this instrument going bad are very high. You can procure the instrument equipment one through some grant or some bank financing, but maintaining these kind of instruments takes lot of efforts in terms of capex and opex. And electrical supply or dust that is there, or the temperatures in these rooms play a very, very significant role. Apart from this, you would require gases like acetylene, nitrous oxide, argon, or even some other gases like nitrogen, for which you would require cylinders. We will talk about the cylinders in the later slides. Glassware washing area or the drying area, this should be around 300 to 500 square feet depending upon the overall number of samples and the glassware that you need to wash. It should be tiled, the floor wall should be good, not cracked, because whatever bad things will accumulate in this area will finally enter into your glasswares also. Separate waste disposal containers for the broken glass is something very important, and water supply, lab grade water would be very important for this particular lab section. This microbiology lab section is one of the most critical in terms of infrastructure development. Many of you would have experience of working in a microbiology facility or a clean lab facility, because the products that you are involved into are very high risk categories, especially related to microbiological contaminations. So here the lab should be able to analyze the parameters based on Appendix B of the FSSAI standard, which are subsequently put across as various tables, parameters or the pathogen parameters. The air quality in this room should be as per ISO specific. Would require 10,000 facility or class 1 lakh facility for this particular laboratory. Appropriate containment. Unidirectional flow is the most important part in the microbiology lab. So in chemistry, it may not have a flow, unidirectional. The necessary will have to have a unidirectional flow. The chemical size, the stores that you will be having, you cannot just dump in all the chemicals. मेरा acid भी रखा हुआ है, alkali भी रखा हुआ है, salt भी रखा हुआ है. There are guidelines, there are specifications for storing these different chemicals. Like organic acids cannot be kept with organic bases. They have to keep in separate organic acids or inorganic bases, oxidizers, things which are highly costly or explosives or very hygroscopic in nature. They need to be kept in separate cabinets. And general area requirement is about 500 square feet of lab. The storage is again an area which will have to be demarcated, because there are two aspects of storage. One is the usage, where you will be doing daily, the chemicals are going to be stored for regular usage of daily usage. The other area which your store or your long-term storage will be happening. So here generally this area is again about 200 to 500 square feet. Corrosion resistant storage cabinets like the yellow or red you would have seen for acid storage or solvent storage cabinets need to be used. The glassware or the plasticware or the papers need to be stored separately, so that there is no hazard associated in case there is a fire or there is an explosion. The storage, this is what I was talking about. The cylinders need to be kept not inside the laboratory. At many places, because of some constraint, people will have the cylinders kept inside the instrumentation lab, either in your ICP area or AS area or GC area. but this has to be avoided completely. You cannot keep the cylinders, and whenever you are keeping the cylinder, they need to be chained properly. You cannot keep flammable cylinders, gases like, for example, your LPG or hydrogen near an oxygen cylinder. Otherwise, you are sitting on a atomic on a bomb, hydrogen bomb. Overall space utilization guidelines. Now, many of the time, if the lab is not designed properly, you will have less space for the movement, which can lead to hazards or accidents. So the floor space, the documentation area, the pathways between two tables, the gangways, the exit routes, the locker rooms, the supporting spaces like the accessories of the instrument or the spare parts of the instrument, all these have to be kept in a manner which will be easily accessible, will be safe and secure, and will have better hygiene for the laboratory. Apart from these areas, there are non-laboratory areas also, like seminar halls or restrooms. There are areas where safety showers are placed. All these have to be clearly demarcated while you are setting up a laboratory. Security, ideally to have controlled access to the laboratory by either biometric, by having security guards and security cameras in place. Many times the lab would have radioactive material, cyanide as chemicals. They need to be securely stored properly. Fireproof construction of the lab. You cannot have wooden in the laboratory or things which are flammable in the laboratory for construction. Laboratory signages, these are very, very specific to the laboratory, where you will be marking out details like danger or flammable liquid, acid, alkalis, oxidizing agents, wear masks, wear eye masks, do not eat, radioactive, biohazard, flammable. All these are very, very important lab signages which need to be displayed across the labs, so that health and safety information is clear in this program. The handrail sides, the staircase is big enough because of the design specifications of building codes of India. The corridors between the laboratories is more than 1.5 meters, so that this ingress and outage of people going. Generally, you have a hot room which will separate out the area which will involve muffle furnace or hot air ovens from the actual analysis area or actual where people will be sitting, so that they will be exposed less to the hot area as well as to the contaminated fumes coming out of that area. The photographs that I have covered in this presentation are actually actual photographs of our laboratory. So we have people visiting lab, but at the end of the presentation, if we have some time, I will share you a small video which is about 2 minutes, which will give you the idea of a laboratory setup. Exit doors and windows, emergency exits have to be marked. A proper evacuation plan has to be placed. If there are any disabled people working in your laboratory, so you need to have facilities for that. You should have view panels for each of the doors, so that safety can be seen. If there is any challenge or a hazard associated to a person working in the laboratory, it need not be only restricted towards that lab, but even person moving in the corridors or person sitting in the other lab can also visually see and help the person in case of emergency. The flooring, now many times the flooring get cracked, or it is old flooring, or they will have some carpet put on the flooring. So this is a strict no. The flooring has to be impervious to water, resistant to acids, alkalis. Generally, tiles to be avoided. There are other tiles which are generally acid resistant or alkali resistant or chemical resistant. Those tiles should be used. In microbiology lab, it has to be epoxy coated. Flooring has to be used. The covings of the floor and the wall have to be done. There are photographs of an instrumentation lab, which is an HPLC lab. You can see the flooring is made of tiles which are chemical resistant, whereas the microbiology lab, you can see that the tiles are there are no tiles, but it is the whole area is covered by epoxy coating, food grade epoxy coating. Walls and ceilings. So again, in this walls and ceilings also, you can see very clearly in both the slides. The instrumentation lab doesn't have a false ceiling. Now, many times this question is asked while a lab is being set up, that we need to have false ceiling. So believe me, false ceiling should not be used in the wet chemistry lab as well as in instrumentation lab, for a very simple reason, that if your AC pipes are going above your false ceiling, and if there is any leak, it is going to play a havoc, because it might damage your instrument which is kept below the AC. In fact, you should not be keeping the instrument below the AC. Sinks. Now this is a very important part, because though the analyst may not be working on the sink, but many times contamination to your analysis comes from this sink. So the sink area should be demarcated. It should be generally of stainless steel, but there are now other materials that are also available. There should be a 3-way or a 2-way tap, so that you can use the tap water more efficiently. A draining board, you can see in this picture that there is a draining board for the glassware or the plasticware that is being washed. The other part in the laboratory, very important, are the safety equipment like the fume hoods, the hand-free eye wash, safety showers, fire extinguishers, chemical storage cabinet. So you can see in this picture that there are clear lab signages which will tell what chemicals to store where. There are fume hoods. So there is a fire extinguisher on top. You can see the HVAC line, but also there are sprinklers that are kept in case of fire. These fire hydrant systems will have fire detection alarm going off and the sprinklers activated. Emergency lights, first aid kits, and of course, as a standard practice, MSDS should be available with the lab managers or the in charges, so that what action needs to be taken in case that hazard exposure happens to any employee working in the laboratory. Electrical services and safety. Now you can see this is the electrical room of one of our laboratory, and there are a lot of this panel looks like a very sophisticated nuclear power panels, but then they are very important primarily because the life of your instrument, the life of your equipment is based in the hands of these electrical panels. As a good infrastructure development, sustainable development, you should have individual lab electric meters for your individual laboratories. Lab furnitures, here in italics you can see, and in the photograph you can see two photos. One is the laboratory photo and the other is the administration photo. So the bench height should be about 90 centimeters. The bench depth should be anywhere from 60-90 centimeters. Optimum is 75, but in case the instruments are big like GCMS, where there is a access also that needs to be given to the, it can be about 1 meter bench size. But behind that table, you need to give access in case of instrumentation where about 1 meter or 0.75 meter of access as a passage gangway, so that the engineer, service engineer can work behind the instrument for during any knockdown of the instrument. Sufficient leg and knee clearance under the bench top. Rounded corners is something which generally people forget to put, and this is very important in case of laboratory, because the movement of the people is very high in a laboratory environment. I'll just drink water, give me a second. Till that time, any questions?
No, sir, no question.
Okay, hope all the slides and the information up till now is clear to everybody.
Yes, clear.
Okay, great. So during waste disposal section, you have different type of waste. Here I have documented only chemical and biological waste. But then in the photograph, I have shown that there is paper waste, plastic waste, glassware waste, metal waste, used oil waste, that is there. You can't just throw everything in the municipal dustbin or under the drain. You need to collect the solvent separately. You need to collect the biological waste. For example, in microbiology lab, you will be having the plastic media plates and the media. You cannot just throw it out in the dustbin or in the drain. You need to give it to the licensed company by the local state pollution control board as a biomedical waste or as a biomedical waste. Now, having talked about these different laboratory infrastructures, the right from building to individual labs to safety signages, I would like to put across, this is a add-on slide that we have implemented in our laboratory, which has helped us to get the IGBC Green Interior Platinum rating. So daylight responsive design should have sufficient windows, but they should be covered in a manner where there would be no ingress of any insects or rodents coming from the windows. But light will be coming out, coming inside from the windows. Access to views for occupants. So outside, the occupants also feel good if they are able to see outside instead of doing work in a all wall laboratory. Energy efficient lab design, the height of the lights, the type of lights, the LED lights that are used, interior finishes, furniture with recycled content, easy access to public transport, water efficient public plumbing fixtures, waste segregation, dry, wet, reject, energy efficient office equipment. Like nowadays you get 3-star and 4-star and 2-star office equipment like printers or computers or even microwave ovens and refrigerators. So fresh air being put systems so that it will help improve the indoor air quality and of the bad air coming to the finishes and furniture to have low VOC emissions. This is something which we have put across in our laboratory where 24% of our electrical supply is through solar photovoltaic cells, and in years from December 2019 till October 2022 we have been able to save 4,603 equivalent trees moves to spot extractors to general minimum cost required. What is the question? Somebody has put a question. Can you say that question? So that I will also have some chance to rest my voice And in term, there are 2 questions that have come up. They can ask those questions, please.
Yeah. Participants, questions, please. Sir, in chat box, one question is there.
Yes.
How much minimum cost required to set up only microbiology lab for food testing?
So when it for both hygiene parameters as well as pathogen parameters to be done, a basic microbiology lab setup would be coming to around 1 crore of rupees. Will include the HVAC system, the class 10,000, class 1 lakh facility, your laminar airflow, your biosafety cabinets, your refrigerators, your storage areas, your autoclaves, your incubators. Plus, if you have to have uh, the new technology instruments or equipment like VIDAS or RT-PCR, or you need to have the tempo type of machines, instruments to be used, plate readers which are digitalized, then the cost will go up by another about crore of rupees. So this is a basic, from 1 crore to 2 crore is the basic lab setup cost for microbiology lab. I'm talking about very good, meeting all the compliances. Otherwise, there are labs we set up at 50 lakhs of rupees also, but it will not serve the real purpose. Next question. I hope this has answered your question.
Yes, sir. Sir, one more question is there in the chat box. Yeah.
Okay.
If the biomedical waste facility is not available at your laboratory place, how to dispose the biomedical waste? Any alternative they are asking, sir?
So the first and foremost thing, irrespective of biomedical waste is available at your place or not, you will have to segregate, separate out the waste that will have a potential biological hazard. It will have to be autoclaved. Okay, that means it need to be sterilized completely, and then if it is plastic waste, it has to be separated out and sent out to the chemical waste facility as well, and the media that would be there can be put across with to the local authorities. That you will have to ask them that I have such and such biohazardous waste. If there is an incineration, it will have to be put across to incineration, otherwise it will have to be disposed of by landfill.
Yes,
Is it answered?
Yeah, yes.
Okay. Any other questions?
No, sir.
Okay. Even if there are questions which I may not be able to answer because of the time part, you can always send across the message to me on my LinkedIn account, on EnviroCare Labs LinkedIn, or my personal account Nilesh Amritkar. You can just search on LinkedIn and you will be able to chat with me. So coming to this wet scrubber system, we'll move forward. So how should a laboratory organization chart look like? There will be a chief food analyst who has to be an approved food analyst, FSSI food analyst exam passed person. Under him would be either analytical staff or administrative staff or support staff. So how do we differentiate or divide these, subdivide these different staffs in analytical, administrative? An example is given over here. There would be an operational head or an instrumentation facility in charge. There would be senior analyst. There would be junior analyst. There would be technical assistants for them. There will be sample custodian. Then there will be receptionist or plumber or security, maintenance, housekeeping, estate management, support facilities would be there. There would be administrative officer for your store or purchase, or personal secretary to your director or head. So this is a very basic organogram which can be evolved further by the respective organization when they are trying to set up the laboratory. But remember one thing, the head of the laboratory would be the ultimate responsible person and he would be the spokesperson for the laboratory. He has to know all the FSSAI rules, regulation. He should be trained in NABL 17025 2017, and along with that he should also be aware of national and international rules, regulations, standard operating procedures, at least a bird's eye view of these procedures. What I tried to do is compile the data that was available on various documents of NABL as well as the FSSAI documents, and I have tried to put up, segregate out the requirements of the senior food analyst or the analyst. You can go through this, they are quite in detail. And what the document also says that if you are having about 1,000 samples in a month in a government lab setup, you would require about 41, 40 to 45 type of different people, out of which 50% would be mandatory, 50% would be desirable. The document also gives the aspect of what would be the budget for a laboratory. Now, I don't agree to this budget. I have been running my lab for last 25 years as a second generation businessman, technocrat. The lab itself is around 43 years old, and considering the 43 years of total experience with about 200 people working in our laboratory, the minimum expense of the laboratory is around 15 to 20 lakhs of rupees every month minimum. So what the document talks about is about 1,000 samples, and with about 40 people, I think this number is still very less. It would be around a lakh of rupees minimum a month for chemical, a lakh of rupees a month for microbiological, and about 5 lakhs per month for overall glassware, consumables, CMCs that are required to be done. If you have a GCMS, LCMS, high-end sophisticated instruments will have very high charges for maintenance. Running cost of the instruments are very, very high. The next few slides are about ISO 17025 NABL accreditation process. So apart from the infrastructure, apart from the manpower requirement, apart from the budgetary allocation, the most important part then comes is how do we put up quality management system in our laboratory, and the guidelines to be followed are as per ISO 17025 2017. I have tried to put this in next 3 or 4 slides, but this is actually a 4-day program. Okay, so participants who would like to have specific program of 4 days on NABL 17025, they can get in touch with us and we will be able to do that program specifically for them. We can help you also in putting up your lab for ISO 17025 application. Hand over lab 10, 15. I'll come. Yeah, I'll come. So important is partiality and confidentiality of the people working in the laboratory, which is the 4th clause. 4, 5, 6, 7 and 8. These 5 clauses and their sub clauses are the most important part of ISO 17025. Legal entity of management is the ultimate responsibility of the laboratory. Scope and range of activities, which talks about method, which talks about range, which talks about list count or limit detection, limit of uncertainty of scope has to be defined. The food product that you are going to analyze. So lab which is competent to products. A lab which is doing meat product analysis need not necessarily be competent to do poultry or egg analysis. So the methods would be different, the protocols would be different, the uncertainty of measurement would be different. This all comes under the scope and range. You have to define the organization and management structure. Partially, I have tried to cover that in the earlier slides. Responsibility, authority, interrelationship of the personnel needs to be defined, and you need to communicate the effectiveness of the management system to all the people within the organogram. The personnel, facilities, environmental conditions, equipment, we have discussed this, metrological traceability, everything that you do in your laboratory should be traceable to SI units. The externally provided products and services, if you are outsourcing your analysis, if you are outsourcing your calibration, if you are outsourcing some part of your sample processes like sampling or sample subsampling, that needs to be documented properly under the clause number 6. Clause number 7 talks about the mechanism in which you will select, verify that or validate the method that you are using in your laboratory. Handling of the test items, how you are going to store it, what would be your TRF or the test request form, chain of custody, technical records, measurement of uncertainty, reports or reporting. How would you report the results that are coming out of your laboratory? How would you handle the complaints, internal as well as external complaints in form of non-conforming work, and the control of data and information management system. The last clause is that of management system requirement. Thank you. Where if you are a 9001 certified organization, it would be very easy for you to meet the compliance of these clause, because it talks about management system document, the records and improvement and corrective actions. But apart from this, it also talks about internal audit and management reviews. There is specific guideline on how do we do internal audit, and the person who is doing the internal audit has to be certified internal auditor or has to undergo a 4-day training program for the carrying out internal audits. Management review mechanism has to be very strong, because that is the foundation of all the clauses that we talked about earlier. The 4, 5, 6, 7, 8 and its sub clauses are all reviewed at least once in a year by the management as a part of management review MRM, which also needs to be submitted to NABL as a part of documentation and application system. This is a sort of a schematic representation of how all the clauses are interlinked to the actual end user, the customer. So you can deep dive on this once you go through the whole program of ISO 17025, but this is a very simple way of understanding how a technical record or how sampling is related to customer. So lastly, this is my last slide before I take up more questions. This is the building wherein we are housing our laboratory, and I would like to thank my team members, Dr. Preeti Amritkar and Sujata Chute, who is a food analyst at our place, to help me compile all the data and come up with this presentation. There's a LinkedIn link given over here. You can click on that and you can very well follow EnviroCare for more updates on various aspects of the laboratory. So that's it. Questions, sir, from the participants?
Yeah, thank you. Thank you so much. Very nice and excellent presentation. And you have covered all the parameters which is required for the establishment of the food testing lab. And not only that, the basic information you are given, but you are given the information with relate to the various regulatory bodies which requires the facilities to be created for the testing the food samples like FSSI, FDA, BIS, APEDA,
Sir, last question chal raha hai.
and GAPTA.
Thank you, chal raha hai. Yeah.
Hello.
Sorry, sir.
Yeah.
Yeah, sorry. Please continue, sir.
Also, you have given the brief information about the accreditation part also, enable accreditation, how we can have that. And as you mentioned, this 4 to 5 days program will be required for to know about what is the ISO 17025 2017 for implementation. These guidelines are required for the establishment of the any food kind of the laboratory, so that you have explained in very nice way. And definitely I feel that all the participants has benefited from this your talk, and definitely in future also. So they will be in contact with you. Your lab is number one lab in Maharashtra, and providing services to all kinds of the food industries. Uh, I think there is one question in the chat box. Uh, the molecular biology chemicals, how to dispose it off? So that is again asked by the Prashant Suryavanshi.
Okay.
Yeah.
Okay, so molecular biology, good point is that the volume of molecular biology chemicals is very, very less. So it is very easy to dispose. Uh, of course, any material or any biological specimen in that, you need to sterilize, autoclave it, and then you can dispose it off as a regular your municipal waste or through a biomedical waste facility.
I think that questions maybe he might be asking with regard to some of the dyes which are mainly used for the PCR, RT-PCR. They are in carcinogenic in nature. So I think Dr. Prashant Suryavanshi, you would like to ask?
So, with respect to some of the carcinogenic dyes that are used nowadays, there are different technologies that are available where you don't have to use those dyes.
Yeah.
One. Second is, in fact, if you look at even BIS also, BIS is made a mandate that all the methods wherein mercury was used will have to be changed for a non-mercury based methods. So likewise for us also, we will have to change to new technologies that are there. But even if you are using it, there are various ways of using that chemicals wherein they need to be negated out. There are protocols given in many artists to dispose of these dyes.
Yeah, very true. I think there is one more question is there. Is there any guideline respect?
Yeah. So last question, is there any guideline in respect to quantity and time frame of food sample retention?
Yeah.
So generally, the laboratory has to decide its sample retention policy. In case of regulatory sample, generally, if it is a non-perishable sample, it can be stored from 1 month to 3 months. And in case of perishable, you can discard it once you are submitting the report and the report is accepted by the customer.
Okay.
Is that okay?
Yes. I think there is no more question. So thank you so much, Doctor, once again from all my team for participating and sharing your valuable experience with all the participants.
Yes.
Yeah.
So thank you, sir. So should I take your leave?
Thank you, sir. Yes.
Thank you so much, sir. I will stop sharing as well as I will come out of the system.
Yes.
Huh?
Okay.
Thank you, sir.
Thank you. Bye-bye.
Okay, thank you, sir.
अरे यार ठीक है sir. Dear participants, for tomorrow's session, we will have again two experts. They will deliver their talk. Yeah, and tomorrow is the last